It's been a busy time of year as educators, parents, and students return to the classroom this week. New clothes, backpacks, and school supplies have been checked off their lists, but Manitoba health officials are reminding parents of the importance of vaccination and protecting your kids from getting sick. Joining us now is Manitoba's Chief Provincial Public Health Officer, Dr. Brent Roussin. Good morning, Doctor.
Good morning.
Thank you so much for joining us. Now, this is the time of year we've been playing outside for much of the summer. Now we're gathering inside again. Kids are back at school in the classroom. This is typically when people start getting sick again, right?
That's right. You know, every year around this time in fall and early winter, we start seeing the respiratory virus season. You know, and that's going to include influenza, RSV, a number of other respiratory viruses, and now COVID is part of our reality as well.
And so at this time, there's like some reminders that we've sort of been hearing now since COVID. Wash your hands. What are some of those reminders? That's
right. You know, and so we always have to be alert to the benefits of hand washing, which is year-round, really. So frequently washing hands, staying home when sick is really important. Coughing into the sleeve. So just being alert that this time of year we're always going to see that increase in respiratory viruses, and there's a number of things that we can do to protect ourselves, and one of the best ones is vaccine that we'll talk about here.
Okay. So Thanksgiving is just around the corner, and so the kids are fairly healthy and it's easier for them, but it's when you gather with the elderly people that you need to worry about, right?
Well, certainly there's people in our population that are higher risk of severe outcomes with these respiratory viruses, certainly those over 65, those with underlying health problems. And then with children, those you know, under 5 years old are also at significant risk of influenza. And so that's a cohort in our population that we've seen declining uptake of influenza vaccine, and so we really want to get that message out. Those kids 6 months to 5 years are at significant risk of influenza. We really want to see those vaccine rates improve this year too.
Okay, and so let's talk about some of the vaccination programs that we've had, because we know during COVID a lot of kids sort of fell behind on their vaccination protocols. Have we caught up? There was a mandate or a program to try to get them caught up?
That's right. You know, so access to health care and to vaccines during much of the pandemic were limited, and so there was a lot of work to and outreach to try to get those vaccine rates up, and so a lot of the regions did a fantastic job in public health and the healthcare providers, and so we've made a lot of headways on increasing those rates back up to pre-pandemic levels in most areas, but we certainly see some areas where we would like a lot of improvement.
Okay, so one of those vaccines is measles, the measles vaccine. As of August the 9th, there were 4,638 measles cases across Canada, including the death of a child. And here in Manitoba, we had 182 cases reported as of August the 9th. Remind us what measles is and why it is so dangerous.
Yeah, so measles is a respiratory virus spread through the air, coughing, sneezing, these type of things, and is one of the most contagious viruses that we have, and it can cause very severe outcomes with pneumonia, neurologic complications, even some delayed severe complications that we can see. So we don't see a whole bunch of that, you know, up until recently because of the success of the vaccine.
Right.
This vaccine, 2 doses of the measles vaccine is you know, nearing 100% effectiveness. So so it's really unfortunate that we see these outbreaks now, because most of these cases could be prevented.
And if your kids are exposed to someone and they're not vaccinated in school, they have to be away from school for 3 weeks.
Well, and this is certainly one of the public health approaches to this. So if you're a contact to a case and not immune, so not vaccinated, the risk of you acquiring measles at some point within that next 3 weeks, the incubation period is very high. And so we want to ensure that you're not going to be exposing other people should you fall ill. So in many cases, if you're unvaccinated and exposed, even receiving 1 dose can sometimes allow the child back, but it will depend on the circumstances.
We're almost out of time already. The fall vaccination program, we're still working out details. We should know more in the next month or so.
Right, we're going to be getting a vaccine usually end of September. We start with the high-risk areas, personal care homes, and then you know, mid-October, so keep a lookout for our messaging.
Okay, thank you, Doctor.
Great, thank you.